All right. Well, I'm Salvador Jaime. I'm a Post-Doctoral Fellow at City of Hope. And, as a general outline of our project, we decided to embark in this project in order to evaluate what the impact of insurance payer status was on both clinical practice and on oncologic outcomes, particularly overall survival in patients with metastatic urothelial carcinoma. So what we did is we evaluated 356 patients from two institutions, City of Hope and Huntsman Cancer Institute, and we grouped them into patients on Medicare, patients on private insurance, and patients on Medicaid/uninsured. I do want to highlight our group of patients on Medicare was further stratified into those that had a secondary insurance coverage and those that did not. Here in Table 1, one of our main and very interesting results is that we see that patients on Medicare were more likely to be on subsequent lines of systemic therapy beyond the first line, as we see a higher prevalence of patients in these further lines, second, third, even fourth line of therapy in comparison to their counterparts on private insurance and on Medicaid. And, as physicians, this is really astonishing to see, as we know that in the metastatic setting of this disease, patients will hardly remain on the first line of therapy. Either they will become progressive or some degree of resistance will be noted. And it's astonishing to see that the insurance payer status can have something to do with if you're more able or not to undergo subsequent lines. Figure 1 highlights the overall survival of all our populations. Bottom line, patients on Medicare did the best. They had an overall survival of approximately 45 months, median overall survival, in comparison with patients on private insurance or Medicaid, which was around 28, 29 months. And figure 2 is where it really gets interesting. This is only patients on Medicare that were stratified into secondary insurance and no secondary insurance. Patients on Medicare with secondary insurance was the best population that we had and that did the best. Their overall survival was a median of 50 months. And I know these are just numbers right now, but to put it into perspective, our best group, which is this one, compared with the group that had the worst overall survival, that's a difference of more than 20 months in survivability. So that is more than 1.5 years based on the insurance status and what our data suggest. So, what's the impact of this study? The first one is patients on Medicare seem to have an improved overall survival, particularly those with a secondary coverage when compared to other insurance payer status. And the second one is what we highlighted in Table 1. Patients on Medicare were more likely to undergo subsequent lines of systemic therapy beyond first-line treatment when compared to their counterparts. Thank you very much.